At this point, I'd like to ask you to pass down your cards to the end of the line, and my colleagues will collect them from you, and we'll address some of the questions to our guests. I guess part of what was shocking to me personally is the fact that how some of these symptoms are things that we can sometimes just disregard as something normal and not give high attention to, while they could be indicators to some serious problems that we might face in the future. So my first question would be to you, Dr. Mia. You talked about some of the signs and symptoms that we can, probably look out for. How many of these symptoms have to be present? Is it just one of them that triggers an alarm, or is it a combination of all of these signs that then, might be a red flag for us to go and pay the doctor a visit?
It's a very good question, and that I would say is the challenge in Alzheimer's disease, because many of these early signs can be thought to be a normal aging, or if we are very stressed, we can feel that the memory is not functioning. So my advice is often, if these problems continue, it can be one or it can be several, but if they continue even when we are living in a more peaceful phase, and if it starts to really disturb daily living, then it's time to do something. And the short-term memory problem is most often the starting one, and then the others, problems with communication, concentration, will follow. But there are individual differences, so it's more if we see that this will continue and if it gets worse.
Okay, all right. My next question is to Dr. Jaakko. You spoke about, the amazing results with type 2 diabetes, where we noticed that for some people who follow the combination of a healthy lifestyle, a diet, as well as other factors, that they could completely prevent the type 2 diabetes. Is that specific for a certain age group, or could it ever be too late to start the change?
I think it's anybody who has a high risk for type 2 diabetes can benefit in the same way. We tried to see whether the effect was better in men or women or different age groups and so on. No difference whatsoever. Okay. So basically across the board, everybody seemed to be benefiting. But the higher your risk is, the more you benefit. And that means that the older people benefit a little bit more than the younger people. And also if you take a combination of a degree of obesity and physical inactivity, then you may benefit more if you are on the worse side. So, but basically everybody will benefit.
Okay, thank you. We have a great question from our Twitter feed. A question from His Excellency Ambassador Michael Corbin. And this is a question on Alzheimer's. It says, basically, could we say that the fact that people who work longer and retire at a later stage in their life, can this slow the onset of dementia?
It's a very good question, and if we think the hypothesis that active lifestyle is protective, we could say yes, because especially after we retire, it's a kind of risky phase. And then it's especially important to get enough activities. On the other hand, I mentioned about stress. That's not good either. So if you have a work that you feel it's too stressy, that may have a negative influence. So I would say individually you need to think what is good for you, but in general activities are good for the brain. And really we have learned so much more that brain can change. Everything what we are doing, you can build new contacts between the nerve cells. So activity and new challenges are in general very good for the brain.
That's great. I hope that answers your question. We have a question from some of our guests here, and I guess that this question can be addressed to both of you, Dr. Jaakko and Dr. Mia. It basically says, does the gene play a role in getting Alzheimer's or diabetes? And a follow-up would be, could pre-implanting some genes in our bodies reduce the risk of inheriting some of these diseases?
Genes, yeah.
For all diseases, we always have a contribution of genetic factors. And for chronic diseases where we have tens of different lifestyle risk factors, as we have shown here, we also have tens of different genes. For instance, in type 2 diabetes, we have characterized now about 80 different genes, 80, that are linked to type 2 diabetes. Alzheimer's disease is a little bit less, but also the list is becoming very big. Now, these genes do not cause a disease, but they make people to develop the disease easier if the unhealthy lifestyle is practiced. That's how it goes. And the most important thing would be that if you have a strong genetic background, let's say you have a very strong family history of diabetes, it would sound that the bad news, but it's not necessarily bad news. Just if you practice healthy lifestyle, these people would benefit tremendously from healthy lifestyle.
Okay.
And it's very similar for Alzheimer, just shortly, that it's really, we have in Alzheimer's disease, that's maybe the only exception. There are very few cases where it's really like genetic cases, early onset Alzheimer's disease, when you get the disease when you are younger than 65, but they are very rare. Less than 1 or 2% of all Alzheimer's cases are really genetic, and all the others are combination between genes and then these factors, lifestyle factors.
Okay.
And it's the same thing that Jaakko said, healthy lifestyle also for persons who have genetic factors is more beneficial.
Okay, so I guess this also links to one of the questions that we got from the guests, which is if a patient starts showing some symptoms of Alzheimer's and then they implement a method, would it slow the progression of the disease? If they include the things that you mentioned, would that slow the progression of the disease?
We have seen many patient cases when they really take all these healthy lifestyle, nutrition, activity, they do much better. It has been not so easy to show all these things with the studies, but there are increasing amount of studies that you can do it. Can you really stop the disease? Can you postpone it? It's difficult to say, but absolutely all the healthy lifestyle factors, activity are important not only to prevent, but especially I would say for persons who already have memory problems and Alzheimer's disease.
And if a person does not intervene and does not make any changes, how long have you noticed that a person usually has before a person passes away, basically, which was one of the questions we had here?
For Alzheimer's disease, now people are living much longer. We know that. I mean, it can be 10 years, it can be 15 years. I have had patients who have survived 20 years. And one thing is nowadays we make the diagnosis much earlier. I showed these pictures that in the brain, Alzheimer's disease may start 20 to 30 years before we get the symptoms. So really the disease has a long course. So it depends what time we do the disease, the diagnosis of the disease.
Right. And I guess the same question applies for diabetes as well, is if someone finds out, but they do not do any change to their lifestyle and they don't try to slow it down, how long usually does a person have?
Well, first of all, it has been estimated that the life expectancy is reduced by approximately 10 years with diabetes. And if you don't do anything with your lifestyle, it's probably more. So this is the average, 10 years. So those individuals who are taking good care of their diabetes and other risk factors, blood pressure, cholesterol, at the same time, their life expectancy can be almost as long as non-diabetic individuals.
And I'd like to just conclude with this one last question, which could be very relevant to the UAE and the situation with many people here, which is vitamin D deficiencies. You talked a little bit about intervention studies with vitamin D. Can you elaborate a little bit on that? One of our guests sent us a question and would like to know more about the relation about that.
Yes, vitamin D. There have been some studies now showing that vitamin D really is related. It's related for many chronic disorders, but even with brain health and Alzheimer. And we have new study coming showing really a clear relationship between low levels of vitamin D and these Alzheimer changes in the brain. So absolutely, I think it's one important vitamin, of course not the whole solution, but one important vitamin. And that's why in our countries we don't have so much sun. So our recommendations for elderly people is to get vitamin D supplementation. So that's, I would say, the only exception for the picture I showed. Vitamin D in our countries is needed for elderly people because we hardly see any sun in the winter time. You have a different situation here, but I think it's important to realize that you need some sun to get vitamin D.
We
so
have
that's
a different situation.
Yes.
We've got the sun, but we try to
yeah,
avoid it most of the time.
Yes, so I think we have started to realize it more and more, the importance and the good signs of the sun as well.
That's great. Thank you so much to both of you again. We really appreciate your presence, and I thank all of our guests for joining us tonight. One reminder, though, you have the evaluation forms, and to help us provide better programming, please do fill out the short evaluation forms, and you can hand them to some of my colleagues on your way out. Thanks a lot for joining us, and have a good night, everyone.